I think I can safely say that most of us have tried out an AI chatbot. Maybe for something medical, maybe just for a difficult question you didn't know where to start with, maybe just out of curiosity. And for me at least, there are a lot of complicated feelings around using AI at all. Is it using up all the water in some town in Texas? Is it just feeding me copies of a copy of a copy of something that was bullshit to begin with? Are there any ways to use this tool to solve any of my many problems that won't harm me or harm anybody else? I don't have answers for you about those big picture AI questions. That's not really my beat. But I do have someone to talk to who, even as a licensed pelvic floor physical therapist, still turned to an AI chatbot to help her figure out her diagnosis after decades of misdiagnoses and overmedication from her doctors. So how did she use this chatbot as an effective tool to successfully get her diagnosis and surgery? How did she handle discussing this with her doctor? And how does she think us regular people can replicate her success?
We don't know because we've never really studied the female body. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't. 'Cause we've never really studied the female body.
Welcome back to CRAMPED, the podcast where I try to find answers to my and other people's questions about their period pain. I'm your host, Kate Helen Downey. CRAMPED is a completely independent show, which means we don't have a network or a brand footing the bills. I research, write, record, edit, and release these episodes every week because I don't want anyone else to spend 2 decades in severe period pain without a diagnosis or treatment like I did. If you think that's a worthy goal, and you'd also love for me to be able to quit my 3 other podcast jobs to make CRAMPED full-time, head over to patreon.com/cramped. Think of it as buying me a cheap glass of whiskey once a month. And in exchange, I sit at the bar with you and I tell you research deep dives, wild medical stories, and things that experts have told me. Admit it, you've bought drinks for friends who bring less than that to the table. You also get bonus episodes, voting rights on episode topics, and for $25 a month, which is just the cost of a light lunch here in LA, you get to assign me a research question every month. That's patreon.com/cramped to keep this project going. And just a quick reminder before we dive into this episode, I am not a doctor. This is not medical advice. Everything presented in CRAMPED is my own and other people's personal experiences. I am just a research nerd with a uterus and a microphone sharing what I found. And today, what I found started with a cramper, who was also named Kate, sending me a New York Times article about women with complex chronic illnesses using AI chatbots to help them get a diagnosis. The article is called "Doctors Couldn't Help Them, They Rolled the Dice with AI." And it was published April 2nd, 2006. If you want to go find it on the New York Times site, I'll put a link in the show notes, but it is behind a paywall. AI chatbots have been a hot topic over the last year and a half. Some people say it's going to save us. Some people say it's going to be the downfall of humanity. It's basically the same stuff that gets said anytime there is a new technology widely adopted. The same exact things were said about things like electricity and bicycles. I'm serious. There were whole-ass newspaper articles in the 1910s, also in the New York Times, by the way, about how if you ride a bicycle, your skull will change shape because humans weren't meant to be able to go that fast. So for what it's worth, I think the chances are very slim that AI will either save humanity or end it. My bet is we as a species will figure out how it fits into our lives, sometimes for the better, sometimes for the worse. But obviously, as someone without a medical background who has had to use every tool available to her to try to find answers to my own pain and to try to navigate the medical system, I have used AI at points along the way. Like any other tool, I find it useful for some things and trash for other things. I do not advocate for every person with pelvic pain to go straight to an AI chatbot for answers, but when you're hitting dead ends with doctors and you're desperate for some information and potential next steps, how can you use this tool to the best effect? One of the people featured in that New York Times article, the one about AI chatbots and chronic illness, not the one about bicycles, they're all dead for sure. One of those patients was actually a medical provider herself. I was interested to hear her full story and to get her take on the place of AI in the quest for a diagnosis.
My name's Caroline Gamwell. I am a pelvic floor physical therapist, and I specialize in chronic pain and pelvic dysfunction, and I practice in Denver.
Last year, Caroline was struggling to get a diagnosis, and she saw that the New York Times was looking for stories about people using AI when doctors weren't helping them. She wrote in, or at least she figures she must have.
I don't remember filling it out at all. Last year was probably the pinnacle of really struggling with my health, and so I was a little bit cranky, and that must have been part of it. And I think I was like, do I have a story for you? Or
You just blacked out and pitched a story to the New York Times.
I think I did.
I think that's awesome. First, I want to ask you, when you first realized, oh no, something's wrong with my periods, this isn't normal.
Well, my periods actually weren't the main problem. I think that's what made my story a little bit confusing. Despite having pelvic issues, it didn't even perfectly fit any textbook. It started as a constellation of really curious symptoms, but it started in high school. It started with pain with urination that continually wasn't a infection. And then it spiraled from there, where I would have back pain and I would have these weird electric shocks that would go into my vagina, but I didn't really know how to describe them. I really struggled with bowel movement issues. So it felt like this really large constellation of everything, including migraines, shoulder pain, stuff like that.
How old were you and where were you in your life when you started noticing this constellation of symptoms?
My mom said she started noticing them when I was 4, which is wild to me. Wild to me. I think my first memory of being in pain and something being wrong was I was about 16 or 17 years old. So I was in high school and didn't really know what to do. And so it got labeled as anxiety. And I was like, okay, well, I'm anxious and you don't know anything. And I have a 16-year-old niece now, and looking back at it, I'm like, yeah, we don't really know anything.
No.
So, and then I went to college. My pain got so much worse, and I tried really hard at that time to figure out what it was. And I went to a whole bunch of specialists. The main problem with what happens is if your initial blood work and your initial imaging all come back as okay, that specialist drops you. I don't think that many people who don't suffer from chronic issues understand that if this comes back normal, then they just don't keep seeing you. They're not let's get to the bottom of this. No one is like Dr. House from that show.
Right. All the medical shows make it seem like every doctor is like a detective trying to figure out these mysteries. And mostly they're just like, well, it's normal. Goodbye.
Yes, exactly. And so I was like, okay, I don't know what to do. And then I got pretty depressed, as one does, and I answered.
Yeah, hard not to.
It's so hard not to, but I'm almost laughing at the naivety here, but it's not my fault. The intake forms that they have you fill out where they're screening for depression. I didn't really know what I was doing, and I filled it out honestly.
Oh, no.
which sounds so funny to say. I was super honest. But my gynecologist came in with a social worker. This was my senior year of college, and they were like, we need to set you up with an appointment in therapy because we're really worried. And so it was what I came in there for was kind of sidelined to be depression. I went to that psychiatrist's meeting, and in the first meeting with her, I was like, I'm struggling, yes, with depression, but then some days I won't be depressed. I admitted I was 21 years old. I was sleeping around a little bit, and I essentially admitted to being a college student. And then I was and I'm having pain, and she was like, this sounds like bipolar disorder. And I got, oh my gosh, it was terrible. And so me not knowing anything, I got slapped with that. and left with a prescription for nerve pain and mood stabilizers. And I went off to grad school. It's like, okay, I have this weird pain and it must be connected to this bipolar disorder that I must have because I've decided to sleep with a guy. But I was also 21. So, you hear it now in your 30s and you're like, oh, I'm so embarrassed that I didn't push back on this.
But what do you know? You're told that doctors know what they're talking about.
They know everything. Yes. Yeah. And I think I was also just excited in a weird way for someone to give me a name to something.
Yeah.
And so I found a psychiatrist in grad school, and I was still having quite a bit of pain, quite a bit of problems. And she put me on a constellation of medications that actually knocked me out quite a bit, and it did dull the pain a lot. So then I was convinced, and I actually remember for years, I told everyone my pain was psychosomatic.
Oof.
And so I just was like, yes. And then but as I kept complaining about it to her, she'd be like, sometimes that psychosomatic can cause like fibromyalgia. And then I was like, I guess I have this. And then it was just weird. And at the time I'm studying physical therapy and, none of the things that they bring up in PT school sounded like me anyway, because they're bringing up like a disc bulging disorder and like osteoarthritis or Parkinson's disease. And so no one's talking about pelvic health. No one's talking about chronic pain disorders. And then when they talk about chronic pain disorders, and this is my pet peeve, I know a lot of PT schools do this. I know med schools do this. They talk about it in terms of like what's called central sensitization. Yeah. And that term makes me want to flip a frickin' table. I hate it so much, even as a provider, because they're like, oh, your brain gets so sensitive and then you're just sensitive. And so if you can't find anything wrong with your patient, you need to talk to them about maybe how it's all in their head. And I think I just internalized that. And it was terrible. It was so terrible. I've been ranting for a while. I'm so sorry.
No, that's what it is. It's never a simple story, right? It's all these things woven together, and all the times doctors have failed you, neglected you, told you the wrong thing, given you a diagnosis. I had a doctor tell me that I was an alcoholic and hitting rock bottom once, because I was in so much pain from my period that I couldn't go to work. And I was like, hang on.
Oh my gosh.
It's hard to separate the trust that you have been taught to have in doctors when they tell you something completely off base. And like, they're people too, and they're going through their own things, and they have their own reasons. They've had their education fail them. They're not bad people, but it is very frustrating to be not just not helped, but actively brought further away from an accurate diagnosis and treatment by doctors throwing shit out there that is way off base that they haven't done due diligence on.
Right. There must be something about the ego somewhere that we all have, but it's okay to say, I don't know what's wrong, but I believe you.
Right.
None of us are upset about that. Okay?
Yes. So eventually you end up a practicing physical therapist. You're still experiencing these symptoms. What brought you to try to figure out your diagnosis with AI?
So I'm going along, throughout the years and doing what we all learn to do, which is managing it. I'm kind of learning my guardrails, and it's late 2024, and I have this meltdown when I'm meeting with my psychiatrist for a bipolar diagnosis that I don't have. And I'm like, I don't feel good on these medications. And they're like, okay, but if you come off of it, you might have a manic episode. I had this moment where I finally was like, I don't think that I have bipolar disorder. And my family never thought I had bipolar disorder. And I did something that is super unadvisable. And I cold turkeyed everything I was on. Oh, it was terrible. But it all of a sudden had this resurgence of every symptom that I think I had been too exhausted to feel, or I felt, but I couldn't even think about it because I was exhausted, and you go from work to being exhausted to work to being exhausted. So I came off of all of these psychiatric medications, and I ended up waking up again multiple times in the middle of the night would be some of when my pain would surge. And finally I end up in the ER, and I end up getting convinced to take my gallbladder out.
Wow. Which symptoms were the ones that were keeping you up?
Mainly it would be this back pain. I did have some pain on my right side, and I had a lot of pain on my left side. And the gallbladder is on the right side. And I even kept bringing it up to the surgeon that I ended up meeting with. And I'm like, I have a lot of left lower quadrant pain. And they looked at me and they were like, so anyway, we should take your gallbladder out. And then I was like, you know what? Fuck it, let's do it. Like,
right.
Because
you gotta do
like,
something.
It must be because I was getting to the point where I felt like I couldn't really eat. I was nauseous. I was bloated. So I was like, maybe it is GI. Maybe all of this is GI. And I get my gallbladder out, and I am trying to recover from that surgery. And then all of a sudden, my legs blow up to the size of like elephantitis. They're huge. I can't bend my ankles. I can't bend my knees. I go to my primary care, and she doesn't even know what to do. She hasn't seen it before. She is sitting there Googling in front of me, which I'm not blaming her. She's like, no, legs and knees swollen after a gallbladder surgery. And so she tells me to go to the ER to drain them. I go to the ER. They think it's blood clotting. They don't find anything. They don't drain it. They send me to ortho. It's like all of this. So instead of that making it really me feel better, it felt like it kind of just unleashed a Pandora's box of all of my symptoms. And finally in October, my knees had drained a little bit. I was just miserable, and I was sitting in my primary care's office, and I was sobbing that I was exhausted and in so much pain. And she was nice about it, but she just looked at me and she was like, I think it's really time that you finally accept the diagnosis of fibromyalgia and chronic fatigue syndrome. And for a week I did. And then again, I lost my mind. Because I think I was just like, you know what, maybe it just is this. I can't figure out anything else.
Right.
It's such a weirdly complicated story. And
it's always a long road, a long winding road.
Exactly. And I think for me, there were so many flags along the way that if I had listened to myself, I would have probably figured it out sooner. So I go to a continuing ed class in October, and I think to myself, this is great. All these physical therapists are so skilled. It's like a very in-depth manual therapy class on visceral mobilization of the reproductive tract. It's a highly skilled set of people. Their hands are going to be great. I'm like, they're going to fix me. They're going to figure out what's wrong with me. It must be a musculoskeletal thing. And I left that continuing ed class feeling, if even possible, extra worse. I was on my flight home, and I thought I was going to die from just the pain, the nausea, the bloating. It was all of it. And I finally had the light bulb moment. I know the one thing that manual therapy always makes worse is a vascular disorder.
Had you learned that because of your physical therapy background?
Yes, and I'd actually taken a class on it the year prior. So it's funny that I sat through an entire weekend course on pelvic venous diseases, and nothing crossed this barrier. I feel so silly. But I didn't realize how much I gaslit myself until I really looked at it, because I would even tell myself I never had chronic pain. I would just be like, I have occasional pain. That happens daily.
Right. I have pain sometimes, all the time.
Exactly. And I think it's because all my patients would come in to see me and they would be in pain. And I think I'd be like, well, I'm not in their amount of pain.
Right.
But you don't know that. And so I sat down on ChatGPT, and I wish I had ended up using Claude, but that's like a whole separate thing. But anyway, I sat down on ChatGPT and I go, okay, I'm having all of these problems. Give me your top 10 hypotheses of what they are. And then scrolled through them, and one of them was the vascular disorder, because I wanted to see, am I being biased on this or not? You know, I'm feeding it back and forth, and it kind of goes off on the rails a little bit. It was like, oh, it's a pelvic floor spasm. And I'm like, no, stop it.
You knew to be
know.
like, no, it's not that.
I think by the time I finally was like acknowledging that I didn't feel good, I just was ready to not be bullshit anymore.
It was easier to say no to ChatGPT than it was to doctors who were like, it's this. You couldn't say no to them, but to ChatGPT, you could be like, no, next.
Right. I did bring this up to my primary care. I was like, you know what? I think I might have this. And I presented it as pelvic venous disease because that's what it's called now. It used to be called a separation of pelvic congestion syndrome, May-Turner's, and Nutcracker. And now they're kind of presenting it as all of it.
So all of these are names for vascular disorders or conditions. They're all talking about like blood flow going into the pelvis is messed up in some way. Yeah?
Pretty much.
Can you talk through a little bit of like, why does a blood flow problem to the pelvis result in pain and the kinds of symptoms that you are experiencing?
Yeah, definitely. I think this is why so many people get confused because it doesn't sound like it would be painful because you never think of blood flow as painful. There's really two different types of problems that can occur. You can either have an obstruction of a major vessel, either your renal vein or your iliac vein, and that obstruction will not allow blood to drain back upwards towards your heart. The body is really good at compensating, and how it compensates is where your pain is going to be. So it will either compensate by saying, I really don't like all of this blood flow backing up at my renal vein or at my iliac vein. These are important vessels. I'm going to shunt it into the leg or the pelvis. And the pelvis is actually a pretty preferred spot. The uterus is a prime target of this blood flow. And I was lucky that I didn't have a lot of uterine symptoms, but it actually is a very common comorbidity with endometriosis. And there's a lot of reasons why people post-endo excisions still don't feel good. And this happens to be one of them. Because the body is like, wow, there's a huge reservoir for storing blood right here. It's the uterus. We can shunt all of this blood flow onto the uterus and then not back it up at the iliac vein or not back it up at the renal vein.
Got it. It's like a better holding area. But then the uterus has like too much blood in it and there's a lot of pain associated with that.
Exactly. And so the compression from blood flow can cause a lot of times in the body, what travels together is like vein, artery, nerve. And they travel in bundles. And so in this little bundle, if you have a varicose vein, you now don't have enough room for nerves. Nerves don't like to be trapped. So you will get a lot of nerve pain, which is what I had, was just so much nerve pain. And that's why everyone thought it was fibromyalgia. I didn't have a lot of throbbing. I didn't have a lot of obvious varicose veins. All of my nerves were so angry because they were being compressed. You can also get symptoms wherever the blood will lay on top of. Sometimes people will think they have endo and they don't.
It's kind of crazy that along your diagnosis journey, I feel like that's how little endometriosis actually gets diagnosed, because a lot of what you were saying, I would have been like, you probably have endometriosis.
And so my surgeon, the one that ended up fixing this, he actually really wanted me to look into endo first. And I was like, okay, I want you to trust me that I don't want to get in another laparoscopic procedure to look for something that I have a deep confidence I don't have. But you're right, it does sound a lot like it because endo just goes everywhere and anywhere. I do think that it's also the discussion of like, is endo ever only just endo? Or is endo also endo and MCAS and endo and pelvic venous disease? And because these symptoms are so overlapping. But you're right. Like the fact that no one except for this vascular surgeon was like, have you looked into endo?
Right.
Makes you just be like, oh, it is really crazy. I think why my brain was like, I don't think it is that, is like the one thing that just never hurt was like, I never had cramps.
Oh, wow. And that's probably also why it took so long to get diagnosed, because I'm sure if you had been having period pain and these other symptoms, that maybe would have made somebody go like, oh, maybe it's pelvic congestion disorder.
Exactly.
We're going to take a quick ad break and we'll be right back.
Because we never really studied the female body.
So then I go, well, I know that if there's a lot of backup of blood flow, an easy way to offload it that would make somebody with this pain feel better, and it's not 100% accurate, but it's pretty good at differentiating, is lay in an inversion position. So that means your hips above your heart. So I'm having a crazy ton of pain. I remember it's like the day before my 31st birthday, and I'm like, cool, I want to die, as it goes. And I get down on the ground at 6 o'clock at my office, and I put my hips up on a chair or a pillow and feet up on a chair, and I'm in an inversion position. And within 2 to 3 minutes, my pain is down like 5 points. Like it's like from a 7 to a 2. And I just start stringing cuss words out because I was like, I cannot believe that I have missed this. But it was like this light bulb moment. And I'm on ChatGPT on my phone. And I was like, well, you will not freaking believe this one. And so I tried to go back to my primary care and I presented this. And she was like, oh, they would have seen that on your CT scan. And that's what made me want to scream, because that's not how you diagnose it. It's a very three-dimensional imaging disorder. And so you just can't see this on a CT scan. And so she wanted to send me back to gynecology is also not really great at diagnosing it.
Yeah.
And so I just called around in a panic and tried to see who would see me without a referral. Because then that's the other problem is like, I can refer patients, but what do you do when you have no one to refer yourself?
Right.
And God bless nurses. I finally get a hold of a nurse at a vascular clinic who is like, it sounds like this. I will refer you to the interventional radiologist is who will diagnose these issues.
Okay.
And she's like, I can see it on your CT scan. So she actually could kind of see it a little bit.
That's what I feel like this is what people don't understand, because they say this about endo too.
Yes.
Is like you can get imaging done, ultrasound, CT, MRI, whatever, and a gynecologist can look at it and be like, I don't see any endo. And then an endometriosis specialist can look at it and be like, yeah, there's endo there. Or there's like specific things that the person doing the imaging has to like do it a certain way to be able to see evidence of endo. And it frustrates me, like, how many ultrasounds did I get that
I'm sure a million
that they were like, nothing's wrong. And if literally a different person looked at the same image, they could have been like, yeah, you have a hydrosalpinx and all your shit's glued together.
It is really crazy because these images, they can be definitely hard to read. I understand why they're like a whole specialty. And it's funny, I did try to feed my images into AI, and then it was like, I'm not a radiologist. I refuse to read this. And I was like, dang it, Sam Altman and whoever put this in, which is a good thing. It is a good thing. But I was like, I just want to know if you see this.
It's also frustrating because we hear so much about AI being like, one of the big ways AI is going to save us is that AI can look at like a pattern recognition, at images, at test results, and like pick things out that like a human interpreter might not see depending on their training. And so it's like, that could be good, but also it's probably good that it's not just like available to all of us all the time.
I know, exactly. So you're like good and bad there. And so I ended up getting a chance to meet with this interventional radiologist, and I brought my husband along because I was like, well, he can't gaslight this white man, can he?
You got to do what you got to do.
You got to do what you got to do. I am really grateful for my education because I felt like I could double down finally on like, I need you to test for this, because he was even very hesitant and he was really nice and really skilled. But I remember he was, again, looking at the CT scan and he was like, I don't know, and like, I was like, I have all of this intense flank pain and pelvic pain and back pain that gets better with inversion and nothing else. And I have pain that lasts after sex and it burns to pee and it gets worse with exercise and he finally was like, okay, we'll do this test, but I don't know if we'll see anything. And then we do the intravenous test where they have to go in through your vein with a camera to actually see it. Because then that's the gold standard, is you're inside it and you can actually see it. And he's really quiet for a moment. I'm awake during the test because I didn't want pain meds. I was like, I don't want anything that could mess this up, when you're just so desperate for answers. Yeah. And he's really quiet for a moment. And then he goes, okay, so it's about 75 to 90% compressed in your iliac vein. And I just was like, come again? I mean, excuse me? Like, can I get that in writing for sure?
Yeah, let me record it. Hold on. Say it again.
Yes.
Let me record it on my phone.
Exactly. And after the fact, we're meeting again, and my husband is there, and he's like, you know, we're talking about doing the surgery, which is just a stent that could fix it. And I was like, isn't that crazy that you said you didn't really see it on my CT scan? And he was like, no, I saw it. And I was like, oh, okay. And I'm so grateful to say now that, you know, I still actually struggle with mast cell activation disorder, or MCAS, but separate of that, like, I am pain-free. It's really, really incredible.
That's awesome.
And
that's so cool
really
that you're pain-free
about
now.
it. As you know, like, there's a huge grief when you're like, I've spent like 15 years in pain.
Yeah.
And a long time of it just telling myself I didn't really have pain.
Yeah.
And to like get over it.
The grief, the rage, the mourning of the life you could have had if you didn't have all this pain and medical gaslighting for decades. Yeah.
So much so.
I don't know what to do with it. I mean, I made a podcast.
I love it. I think it's so important to talk about these stories. I know. But then
I'm still mad all the time, but I get to yap about it with people like you.
It's so true. I'm just so surprised that despite the fact that both of these disorders have been known for so long, endo is not a like brand new discovery.
Nope.
Pelvic venous diseases are not a brand new discovery. You know, what's funny is pelvic venous disease happens to men too. You would also assume that then maybe it would be more recognized. But you just think to yourself, like, why is this? Part of me wonders, there's not much we can do about it now, but we're so split into specialties. You know, you've got your gynecologist and your neurologist and your immunologist, and everyone's looking at their tiny little separate system.
Yeah.
And your gynecologist doesn't really care that you have back pain and headaches. And your neurologist can't give a shit that you have pain with sex. And, you know, I mean, that's a little bit mean to say, but you know what I mean? Because, like, they're thinking about very small. And I think that's why they're missing.
Exactly. And I do have sympathy because there is so much to learn just about gynecology, right? Like, there's worlds within worlds within worlds. And, like, I think gynecology should be, like, 4 different specialties. Right. I think it's crazy that the doctor I go to for my period pain also has to know everything about birthing babies. Like, maybe we could separate those a little bit more so that there could be a little bit more like depth in each of those disciplines. But I get it. All of these people are just people. Like, they can't know everything. But also, like, what are we supposed to do?
What are we supposed to do?
It's why I tell people who are having a hard time getting a diagnosis and have like constellations of symptoms that don't like exactly match anything, but they have period pain, I will often be like, go to a pelvic floor physical therapist. Not just because anyone who has pelvic pain probably has some pelvic floor dysfunction.
Fair, yeah.
Because that goes hand in hand and probably would get some relief just from that. But also because pelvic floor physical therapists, in my experience, and please tell me if you agree with this or not, but they are such good detectives and they're with you for like an hour. So while they're working on you or while they're showing you stretches, they're often like, well, do you get headaches? Well, they're like asking you questions about your life, or like if someone is describing a symptom that they have, they'll like ask follow-up questions about it. That's more time than your doctor spends with you. I feel like pelvic floor physical therapists are often the ones to kind of be like, look into this. Like, maybe see if you can see this specialist because it could be this, in a way that a PCP or a gynecologist doesn't really do for you. They are more likely to throw pills at you or be like, well, your test came back normal. Bye.
It's so weirdly true. And from my training, they were so rigid on us all the time in school of like, you better know if you are, what pain you are working with, because you might be the person that catches their cancer. Not like you're going to diagnose it.
Right.
Because again, if someone goes and complains of shoulder pain, this actually happened to a classmate of mine. She had shoulder pain. She went to her primary care. They sent her to PT, and she was like, wait. I'm a PT student, and I recognize that this is not musculoskeletal pain. Yeah. And it ended up being a cancer. You would have hoped that the PT she would have gone to would have also noticed it. But again, sometimes people can spend a really long time in PT and it not actually be a musculoskeletal disorder. And so they were constantly on us about like, you better understand the difference between what's musculoskeletal, what's visceral pain, what is, autoimmune pain, especially in the realm of pelvic floor when you are seeing more chronic disorders and more vulnerability from people. The thing that I think I realized that confuses everybody is most pain looks like musculoskeletal pain, and it sure is not. Because even your period is going to give you either abdominal or back pain.
Yeah.
And within the depth of your soul that it's not a muscle cramp in your abdomen. Right. You know it's your uterus, but say it's like restricted blood flow.
Yeah.
And you don't know what that feels like.
When I was talking to researchers at the GYRL lab, they're studying the mechanisms of period pain. They said that there are certain kinds of pain that we understand pretty well. Like, if you touch a hot stove and it hurts, like, we know how those signals get to your brain. We know a lot about, like, that kind of pain. We know very little about visceral pain, which is like organs, muscles, the soupy, deep, dark regions where it's just like, ow. We don't really know that much about how those pain signals work, how much pain is associated to like how much like damage.
Really, I think what we understand is evolutionarily, we have so much more receptors on skin, muscle, stuff like that, because if you get a cut, you can do something about it. But they think that the reason why we have so very little receptors in visceral is because by the time something is wrong there, you really weren't going to do anything about it. You were probably just going to die. Right. And so the only forms of pain we can actually feel are things that you could do something about viscerally. So you can't feel if someone was stomping on your liver or poking it, because there's absolutely none of those sensors. But you can feel inflammation and you can feel a lack of blood flow. And so that's what will cause pain. A lot of guarding around it will also cause pain. Yeah. But because it has such very little receptors, it'll bleed over in the spinal cord and bleed back out into its referred musculoskeletal pattern. So even like so much of the pain that I had where it was just up my thoracic spine. Yeah. Eventually someone was like, maybe it's an organ, therefore a gallbladder will take it out.
I want to go back to the AI of it all. I'm fascinated with AI as a tool that we can use in our healthcare because women and people with uteruses are so under-resourced and so often dismissed, abandoned, gaslit within our medical system. But we don't have really alternatives. So there's alternative medicine, and that's great if it helps you. But if we want surgery, if we want prescription medication, if we want to go that route to address, which sometimes we really need, we need to be able to advocate for ourselves. We need to be able to educate ourselves, and we need to be able to, like you did, do our own homework and figure out what might be going on and go into the doctor with a plan and with information and be able to push back on the doctor if they try to dismiss us. And so I am fascinated with how AI can be used as a tool to help us do that, and then also how much at risk that puts us because AI can be so bullshitty and is pulling from the vast internet, which is, at least 80% bullshit. And
it's true.
It's a perfect example. You are a medically educated person. You work in the medical occupation, and you were able to kind of go into a ChatGPT situation with enough context and enough knowledge to be able to kind of say no, that's bullshit, that's bullshit, that's bullshit. This is cool. This might be it. And obviously we don't all have that, and we can't all have that. Do you have thoughts on how people who don't have a medical background can protect themselves while using AI to help protect themselves in the medical system?
Yes, I really think that the best thing that you can do, and I know that this sounds super counterintuitive because everyone's like, HIPAA compliance with AI and stuff like that, but AI is so much better when given a lot of detail, unlike humans where we can get really bogged down if there's too much extra detail. But you almost can't give AI enough detail. They've done studies where they've shown that it is all about how the human reports it. And if that human doesn't accurately report it, obviously, like, AI can't do anything with it. It's going to be a tool that it's not going to go away. I mean, Dr. Google was there for so long. Like, people are going to use it. So it's like, you might as well learn how to use it somewhat accurately. I do definitely recommend just asking it for like multiple hypotheses and then how it would then rule in or rule out each one.
That's such a medical, because I feel like the average person's brain works like, here's my symptoms, tell me what my diagnosis is. And I love the idea of doing it like you're a doctor talking to another doctor and saying like, the patient has this, and this, here's all the details. Give me 10 possible diagnoses and how would you rule them in? How would you rule them out? That's really cool.
Or if you're not even sure about the how would you rule them in, how would you rule them out, another thing that it's really good at is contrasting different pains. One thing that it, for some reason, mine wanted to double down on was a cerebral spinal fluid leak, which I was like, I don't know why you're like so hung up on that, but okay. But I asked it to like compare and contrast a cerebral spinal fluid leak pain compared to pelvic venous disease pain, compared to a few different, and then you can read a little bit more and then go and forward pick out. And so I think if you ask AI to pick something out, that's where you're at risk of it doubling down. But you know you. And that's the thing that I think that most people forget when they're in the medical system is like, there's that fear, there's that white coat syndrome. And a lot of my patients tell me, they're like, you're the expert. And I'm like, well, not in your body. Like, I don't live in your body. I'm not the expert of you. And so I need you to tell me what feels right to you. And so it's the same thing with AI. It's like, you can read a symptom that AI is going to present and you can be like, that actually does not sound like me at all. And then move forward. And I would say, trust your gut because it's not wrong. And then trust, your expertise in your body. And so just use it more as a research tool versus trying to use it as the thing that is going to be like the main answer. I think would help people find better answers or narrow down a lot without getting sucked into it.
Yeah.
I know they're going to build more medical models going out there going forward that hopefully will be more accurate, but that would be my recommendation in using it.
Cool. When you went to the doctor to confirm the diagnosis that you kind of reached by talking to ChatGPT, did you tell the doctor that you had talked to ChatGPT?
No, I didn't. What's funny is I actually told my provider. I had told her that I was ruling things out. And you know what's funny? She was not upset about it. She was like, you know, it's kind of like becoming another empathetic doctor because I was complaining to her about how my surgeon treated me after my gallbladder surgery because of all my complications. And he was like, well, it's not my fault. Your legs are swollen. And I was like, oh, ChatGPT was like, I'm so sorry that you feel that way. And she was like, it's so true. It's much more kind. But I think that when I was really nervous and actually approaching her with something that I was like, I think this is finally it. And I feel like I have one chance to get her to believe me, which is probably not true, but that's just where my brain went. I was too scared to be like, ChatGPT said that it was this.
Right.
And
I don't know that that's wrong. Exactly.
Yeah.
When I got my lab results back after my endosurgery, where they have tested all the lesions that they removed to see if there are endometrial-like cells there, I got the lab results and it says at the top, like, yes, some of these tested positive for endometriosis, but there's a lot of other information in there where I was like, I don't know what any of this means.
Right.
I fed that into AI and was just like, tell me what this means. And I got a lot of really good information that helped me ask follow-up questions to my surgeon 3 weeks later when I actually had my appointment with him. But I didn't tell him that I had run it through AI. And I think a really useful thing is if you're asking, okay, how would you rule this in? How would you rule this out? And the AI is telling you like, well, there's a test called this that you can get done and that will tell you one way or the other. And so then if you go to the doctor and you say, hey, I've done a little research. I think like it feels like this condition fits my symptoms. And the doctor's like, no, I don't think it's that. You could say like, well, can we do this test to figure it out? And if they won't do the test, then you can say, well, I've read that this test is the way to rule this in or rule this out. Can you tell me why you don't want to do this test? And then they might have a really good answer for you. And like, I think a lot of the times the nuance of medicine does get lost in AI. AI might not be thinking about like the way, oh, you're taking this medication and you can't do this test. If there's a good answer to that question, great. If there's not a good answer, then you can go get another doctor who is willing to work with you to actually get a diagnosis.
Exactly.
But you don't have to say, I went on AI and it told me to get this test.
Yeah.
You can say, I read a study, because usually with good AI, with Claude,
it'll bring up a study. Yep.
Yeah, with the Google AI mode, it'll tell you its answer, and then it'll give you some sources. And a lot of times those are like NIH studies or like publications from medical journals, or even just like the websites of foundations that deal with this condition, like the Mayo Clinic. The Mayo Clinic has like really good breakdowns. And so you could say like, well, the Mayo Clinic says this is the gold standard for diagnostics. Why don't you want to give me this test? Or why do you think we shouldn't do this? And instead of being like, I asked AI and AI said I should get this test.
And I think the other thing to add to it is exactly like what you said, where because medical providers are so bogged down by the time that they have with you, like very little, they don't explain the nuance of their thinking. But then you actually, like, the more you can push back gently, like I read that, for example, the IVUS is the gold standard test for getting this vascular disorder diagnosed. Why can't we do it? It's like they can actually sit down and explain to you why it would be better to do ABC first. But half the time they don't do that. They're just like, no, that's not. And I think until someone pushes back, it's like they don't explain their work. But then luckily AI can explain work, like their work to a certain extent.
Right. If anyone is listening to this right now and they are in a similar place that you were in 3 years ago, where you don't have answers, you're frustrated, there's a constellation of symptoms that like isn't making any sense, doctors are not being helpful, what is your advice to them?
Ooh, that is a really good one. Usually I would tell somebody to think about it like this. Say you have a constellation of symptoms and you can't pin them all together and you feel like you're broken in 17 places. You've got headaches and migraine and back pain and period pain and pain with sex and urinary issues and. Do you really have 17 things wrong with you? Or do you have one thing wrong with you? Or wrong with you is a terrible phrase, but you know what I mean. Dysfunction. And it's really that one thing, and it's driving all of it. And more often than not, it is usually something like that. It's usually something explainable, where it's like most people don't have 17 different problems. That's not really that accurate.
Right.
And so I think that it makes it easier if you even pose it to AI that way, or try to back up and look at it like that. And in which case I would ask yourself, if you were to say, okay, all of these somehow fit together, what would you say is your driver? Because whatever your driver is probably going to be the easiest area for you to get an answer. For you, it sounded like your driver of your constellation of your symptoms was the period pain. Like everything got so much worse with that. And for me, in my case scenario, I almost felt like I could live with every other constellation of symptom except for this like really intense back pain. Yeah. And that's where it felt like it started. And that's where my problem actually ended up being. Like your iliac vein is in your deep pelvis, deep low back. And so I think it's like not ignoring your gut, but just thinking about it as like, maybe you're not broken. Maybe it's just the one thing. And I hope that makes it a little bit easier for people. So don't seek someone out to separately. Gosh, so many people do this. They'll be like, they'll get their PT for like their headaches and then their PT for their back. And then they'll come to me and they'll be like, you're just going to fix my period, right? Yeah. And I'm like, I think the problem is everyone's looking at a tiny little piece of this.
And if you've been in pain for decades, there's going to be layers of issues that build up. Like my endo doctor described it as like layers of an onion, where like at the bottom of it, it's endo. Like it's endo. The problem is endo. But your nervous system is like, there's something wrong, because there is. It's downgrading other functions all the time. And that creates digestive issues, or like the inflammation from endo creates all this other shit going on, all these other symptoms. And then on top of it, like you have anxiety, you have depression, because guess what? Being in pain all the time with no answers and nothing you can do about it, being scared about it. So Yeah, pelvic floor dysfunction, because all that pain makes your muscles tighten up, which then can cause issues with pooping, pain with sex, all of this other stuff, layers and layers and layers, where like at that point, after decades, getting rid of the root cause doesn't magically fix all the other layers that have built up.
Linchpin.
Exactly. I think that's really good advice, because it feels overwhelming to try to deal with each of these little things and it's impossible and it's expensive and it takes all your time. But I love the advice of just like pick a thing. Like
Driver.
What is the thing that is yelling the most, and that will dealing with that will probably get you somewhere.
Exactly, because then most likely you're never going to get rid of that inflammatory issue if you don't get rid of the endo driver first. And so that is the ultimate place to start, and probably an easier roadmap.
And so many like good endosurgeons will say, we want you to spend some time downgrading your inflammation or dealing with this pelvic floor pain, because healing is going to be easier for you if you've taken the temperature down on these things and you have support and coping mechanisms for this while you're healing from surgery, which I think is really smart.
So smart.
Okay, Caroline, where can people find you in the Denver area if they want to visit you for pelvic floor physical therapy, and on the internet?
In the Denver area, my business is It's Worth It PT, because that's my middle name, is Worth.
Oh, nice.
So Worth It Pelvic Health and Physical Therapy. One day, and I want to give like a little bit of hope to people, but I feel so sad to tell you that it's not available yet, but it should be available soon. They can find me online eventually with the Pelvic Pain Project. Is a online project I'm creating. It's going to be different online based modules on your like fixing this stuff on your own, because like either you don't want to go in to see somebody, or you've tried and no one else can explain it. But the stuff out there for pelvic pain is not good, and so I'm working on a urinary pain project right now. So my hope is that in the future, and hopefully maybe I'll get a chance to email it to you when it's like each one is done or something.
Please do.
Yeah, Pelvic Pain Project for all of those who just want to find some answers at home and are scared to go in somewhere, or just they live in a medical desert.
Yeah.
So that's my also hope to bring to people in the internet world. So
I love that. Thank you so much, Caroline. That's it for this week's Cramped. If you have had an experience using AI to help you get to a diagnosis with your doctor, I want to hear about it. You can reach out to me on Instagram at Kate Helen Downey, or email me at crampedpodcast@gmail.com. I also absolutely welcome any corrections or further information on this topic. If you like the show and you're getting useful information out of it, buy me a drink over at patreon.com/cramped. If you can't afford monetary support right now, join the free tier and upgrade when you can. See you next time.
What's happening to your body? We don't know, because we've never really studied the female body.